I'm now talking with Dr. John Sennish. He is a physician at the Community Health Center of Branch County, and tonight we are going to talk about strokes. You know, there's a lot of people that I'm sure have symptoms and really don't quite know what's going on in their body and that sort of thing, and then come to find out later after the fact, well, it might have been a stroke. And as we talk about that, what is a stroke?
A stroke is a problem with the brain caused by an interruption in the blood supply, and it's usually going to be a permanent thing.
Mm-hmm.
Strokes are potentially treatable. They're probably better preventable,
Mm-hmm.
but I guess the message to people would be, if you have risk factors, try to get them treated, and if you think you're having a stroke, show up. Go to your local emergency room, get there somehow. Get someone to get you there
Mm-hmm.
right away.
Well, what causes a stroke?
There's two major kinds of problems. First, a blood vessel can simply be occluded, blocked, so there's no blood flowing to a certain part of the brain,
Mm-hmm.
and it may be a large part of the brain. Second, you might bleed into the head, into the brain, or around the brain.
Mm-hmm.
Those are the two kinds of strokes.
All right. Now, I know that there's also, I guess, what I would call just a massive or a general stroke.
Yes.
I don't know if I'm the right terminology, but there's also another one, you know, a TIA. Can you explain a little bit of the difference there?
TIA stands for transient ischemic attack, and some people call it reversible ischemic neurologic defect, and that's just too much, I think. But
Mm-hmm.
TIA, it means something happens, and for a brief period of time, it may be an hour or less if we're lucky, or it may drag on for several hours, but less than a day, something doesn't work. Vision's not right. We may have a loss of ability to move or speak properly.
Mm-hmm.
It'll be something like that.
Okay.
And that's an important warning sign for stroke. Maybe a third of strokes are preceded by a TIA.
All right. And then as we talk about that, what are some of the risk factors?
There's a few. The most common risk factors are hypertension and diabetes, because those are the more common conditions.
Mm-hmm.
In fact, better treatment of hypertension has dropped the incidence of stroke significantly in our United States.
And the hypertension would, extend from what?
Different things, and I think there are some cases called essential hypertension, but if you have hypertension, it's really helpful to know it, and for your doctor to know it, and for that you have to have your blood pressure checked.
Now, is that something that I should do all the time? Have my blood pressure checked on a regular basis?
Good question. I'm sure there are people that never get their blood pressure checked. They never even have to show up for a tetanus shot.
Mm-hmm.
But I think it's a good idea to have one's blood pressure checked every year or two, and then when you get old enough, maybe more often. And if you've got hypertension in your family, maybe you should be one of those people that gets regular checkups.
Mm-hmm. And when somebody does have a stroke, I think that the most common type of thing that people relate to is, again, somebody had a stroke, now they have slurred speech, or maybe the side of their face is not moving, or side of their body is not moving as well, or they walk, with a little more of a limp because, again, some muscles or something is not moving. Are those the main, factors that we would see, or are there other things that happen too?
Those are probably the classic ones and that I think most of us would recognize. But a sudden change in level of consciousness, a person that you couldn't wake properly, you'd worry about drug overdose, you'd worry about low blood sugar, you'd worry about stroke.
Mm-hmm.
They say, how is it? Time is brain. Get checked.
Okay.
Get those. If you run across somebody like that, see if you can get them in to be checked.
Mm-hmm. So there's some of the factors, there's early warning signs like you talk about if, again, a little disoriented or maybe your speech is slurring or something on that order. So when somebody has been diagnosed that they had a stroke, what happens after that? Or is there a certain type of treatment?
There are a few. There are actually, strokes can be treated. Some strokes may receive simply supportive care and treatments to try and reduce the increase in the size and severity of the stroke. Some strokes may be reversed. Seen early enough, there's a number of strokes that potentially could be treated with clot-busting medication, but it has to be very early, within just a couple of hours of the onset of symptoms. And the drugs have their risks, and you don't use them in a questionable case.
Okay.
Yeah.
Talking with Dr. John Sennish, talking about strokes. If you would like more information, of course, you can go to the Community Health Center's website, or you can look it up online. I mean, what is a stroke? Dr. John, thanks for being with us.
Thanks, Buster.
All right. I'm Tim Hart. We've got more coming up. Stay with us. You're watching Our Community.